of speakers for this session, NHS and Social Care in Crisis. So we have people from across the NHS spectrum here today, including workers and community campaigners, which is absolutely fantastic, which is what the People's Assembly is trying to do at the moment. I was a nurse myself on the front line of the NHS for 28 years. I worked in A&E, wards, community settings, and over here in this country I think it's very difficult for people to imagine what it would be like to be unable to see a doctor or get medicine when you need it, or get treatment if you're injured. And that's what this country was like before the NHS was founded in 1945. People died in agony from injuries and diseases that were treatable and curable. And working class people relied on getting care from charity actually, and charity provision was very scarce. And hunger, filth, fear and death was a brutal day-to-day reality for people who couldn't afford to pay for care. And when I worked in A&E in the 90s, we had sufficient staffing levels, and we provided support and treatment to absolutely everybody who came through the door, because each and every one of those people was there for a reason, and we knew that. And contrary to what gets said today, the A&E was not misused. That's a lie to make people believe that cutbacks in the NHS are necessary. And the NHS used to be available, open, accessible to everybody, but it's now changing, as we know. It's harder to get through the gateways of the NHS. The gateways are the GP surgery and the A&Es, and access to these services is being deliberately restricted by the rollout of the integrated care systems. And the NHS used to function on principles of putting patients first, and we all work together in a spirit of collaboration and cooperation. Privatisation has now created the type of fragmentation that makes this impossible. Every ward has a separate budget, and privatisation undermines trade union organising, as we now have to work across multiple employers. And there's an atmosphere in the NHS now where strict accounting comes before patients. And I have to say the NHS is nothing without its staff who work within it, and their working lives are being made increasingly difficult by repeated restructures. Cuts to the front line are always part of these restructures, and promotion for those higher up the line as well. And years of this type of upheaval has now created the recruitment crisis in the NHS that we're in. We've more than 100,000 vacancies nationally, 40,000 of those are nurse vacancies. And these workers did deliver for the country during the pandemic. And this Tory Covenant plans to repay NHS staff with a further real terms pay cut. And so NHS staff are demanding a 15% restorative pay rise to make up for more than a decade of wages being driven into the floor. And we know that the privatisation agenda has got to be advanced even further. Any outsourced worker, any cleaner or porter in a hospital will tell you straight they want to go back into the NHS and NHS pay terms and conditions, because private companies don't even pay for hours worked in a timely way. And the health and social care bill that Tories are pushing through must be opposed, because what this bill is designed to do is it will open up the NHS to even more privatisation. It will deregulate NHS roles, which will lead to a drop in standards. So it's important to reiterate that the public, the patients, the NHS staff, they're all suffering under what this Tory government's doing, and it's set to get a lot worse, which is why it's so important for us to organise against them and link up the trade union disputes, the NHS community campaigns, and even link up beyond the NHS itself, because the fight for the NHS belongs to everybody. And the reality is, if we don't succeed, there won't be an NHS in the next 10 to 15 years. That's a reality. Patients are already being pushed into the private sector. The social care system is completely privatised now. And that's why the demand for a fully nationalised social care system is so important, because patients are being forced to pay for the costs of care. The plans to increase privatisation are also a pretense for insurance companies to move in and for us to move over to an insurance-based model. So I'm going to stop there, and I'm going to hand over to our fantastic panel of speakers who will go into more depth than all of these topics that I've just raised. So our first speaker tonight is Alison Treacher. She's a representative from Unite the Union.